Now, to make a diagnosis of malnutrition, we need to have certain points in mind. The first element in the diagnosis, we should still use the SchrDbb algorithm. So on the SchrDbb algorithm, you have the first point is the diagnosis. And when you put the diagnosis, you should classify the diagnosis. You speak about the etiology, you speak about the complication, and you speak about the prognosis, like in the case of a severe acute malnutrition that has a worse prognosis and needs admission. So for the diagnosis, how do you diagnose? Here you talk about malnutrition. Malnutrition can be used with undernutrition interchangeably. Is it clear? Undernutrition, they can understand you. Is it clear? But the best word to use here is undernutrition. So undernutrition, you classify. So you speak about, this is the case of undernutrition, which is they speak about the first thing. You should speak about your diagnosis, the severity of the undernutrition. I've forgotten to bring you to speak about this very important element. The severity of undernutrition can be visualized on the Z-score, and it can also be visualized on the mid-upper arm circumference. I've forgotten to tell you about this again later. For the mid-upper arm circumference, we have said that it can be divided into mild, it can be divided into moderate and severe. Is it clear? Moderate and severe. In the case of malnutrition, you are going to have a mid-upper arm circumference between 12.5 to 13.5. If in case of moderate, you are going to have between 11.5 to 12.5. And in the case of severe malnutrition, it's going to be less than 11.5 centimeters. Or you still use the Shakis tape, and when it is yellow, it is mild. When it is green, it is mild. When it is yellow, it is moderate. And when it is red, it is severe with the Shakis tape. Is it clear? The Shakis tape. Now, those are the different things, but this one is just use the normal measuring tape. That is for the severity. So when you speak about malnutrition, speak about the severity of the malnutrition. The next thing, and how you make the diagnosis of malnutrition is very important based on the weight for age. Now, the next thing you speak about the timing of the malnutrition. Is it malnutrition acute? Is it malnutrition chronic? Or is it malnutrition acute on chronic? Is it clear? Then the next thing you speak about the clinical syndrome of the malnutrition. Clinical syndrome of the malnutrition. For the clinical syndrome of the malnutrition, you can speak about kwashiorkor. It can be kwashiorkor. It can be marasmus clinical syndrome. It can be kwashiorkor clinical syndrome associated with protein malnutrition only. It can be marasmus clinical syndrome associated with protein energy malnutrition. It can be marasmic kwashiorkor. Is it clear? It can be marasmic kwashiorkor malnutrition. Malnutrition, and then the last one we have other non-classified syndrome. Is it clear? The patient is just coming with malnutrition, but he doesn't have a typical syndrome of kwashiorkor nor a typical syndrome of malnutrition of marasmus. So you have other non-classified syndromes. Is it clear? So those are the clinical syndrome that you speak about. After speaking about the clinical syndrome, you speak about the pathogenesis, the etiology of the malnutrition. That's the pathogenesis. Is the malnutrition as a result of low intake? You have it based on your past history or your nutritional history. Is the malnutrition as a result of chronic disease? Is it as a result of malabsorption? Is it as a result of, you speak about which particular pathogenesis involved? And then the last one, you speak about the complication or the pathophysiology. Which particular pathophysiology involved? Is there any infection? Is the child having, after the malnutrition, was the child having pneumonia? Or those are the different things that you have to know. Speak about the complication of that malnutrition. Is he having anemia? Is he dehydrated? Is he having hypoglycemia? So those are the different things you have to speak about on the diagnosis of malnutrition. After diagnosing malnutrition, now we move on to the prognosis. The prognosis of malnutrition in your diagnosis is that severe acute malnutrition is having the worst prognosis with the highest mortality rate, and thus he has to be admitted, the patient has to be admitted and managed in the ward. So that is the end in the diagnosis of malnutrition. After the diagnosis of malnutrition, we now move to the investigation.